If you run a large practice, watch how every inquiry, treatment, and follow up gets an owner and is monitored in one place. If you run a small clinic, watch how one receptionist with Aumy does everything a big team does. The chasing, the reminders, the reviews, all handled. So, this is a full 6-point periodontal chart. And for tooth 16, I have recorded pocket depths of all 6 sides. So on the buccal side, it's 435, and on the lingual side, it's 645. And I have also recorded the recession 102212, and the clinical attachment level is calculated here. So yeah, this is a basic periodontal chart. And then we have a odontogram here, and each tooth is color coded by its active condition. I record a procedure straight onto the tooth, and the name auto completes from standard CDT codes. Like you can see, this tooth 11, it is caries, and then 23rd is crown, and 24th is missing. Let me show you the treatment plan. So this is how we create a treatment plan, phase wise, itemized, for a patient, where in phase 1 it's disease control, scaling and polishing. Then the phase 2 is root canal treatment, and then the cap for teeth number 46, and dental implant for teeth 36, bridge for 35, 37. You can also just directly click on send button, and this will go to the patient's WhatsApp number. And you can also simply click the PDF button here, and that generates a PDF, and you can send it to the patient. Okay. So here's the PDF, and the entire treatment plan is mentioned here, and the entire estimate is here, and you can share this with your patient. The moment the patient accepts the plan, Aumy runs a care framed reminder cadence on 3rd day, 7th day, 15th day, 30th day, and 60th day. Each message names the next procedure and its planned date, and stops the instant they book. If the cadence ends with treatment still pending, it raises a task so a human can close the loop. So let me show you the dashboard. So here on the dashboard, in a very organized manner, your team can see your entire clinics and your team's performance. How many new inquiries you got within last 30 days, how many were converted, how many were lost, and how many were not followed up. Advised treatments, so where you have advised treatment to the patient, but the patient said that I'll have to think about it. It's different than the treatment plan. Treatment plan is accepted. So here, total 90 patients were advised the treatment, 26 accepted, 13 declined. And you can see the performance user wise as well. So these are all your users and the individual tasks assigned to them. And this is a similar thing for the treatment plans. On the patient level, you can see which are all the patients in the upcoming treatments, and your team can directly call them or message them on WhatsApp from here. Same with the advised treatments. We have our retain and recall. So how many patients Aumy send the recall messages to, the cleaning consultation, the regular recalls, and how many of them booked and how many of them did not respond. Similarly with reactivate, so how many patients, dormant patients, for this package, wellness package, did Aumy message, and how many booked and how many did not respond, the percentage. So this is in a very organized way. Everything can be managed by your team. So each task has the owner. You can assign a task to your team. So all of this for individual owner is visible in their own inbox, and they can action their tasks from here. So guys, in just 5 minutes, real clinical depth your team trusts, a plan that converts itself, patients who finish treatment, and one screen that runs the practice. If you're a large group, that's accountability across every chair and every staff member. If you're a single clinic, that's the honest truth. With Aumy, one receptionist can now do everything a big clinic does. That's convert, care, retain, reactivate, grow, and manage.